Hello, everybody. Good evening. Namaste. Assalamu alaikum. Sat Sri Akal. How are you all doing? Yeah. Hello, everybody. This is Dr. Syed Mujahid Husain, aka Dr. High Five. You can call me, so no problem. So yes, as discussed, we are live today. I'm live today with you all, and this is my first YouTube live. So congratulate me on that. First and foremost, let me express my gratitude to each and everyone out there for showing that kind of love, respect, affection, for your messages, for your admiration, which is really motivating, which is really inspiring. I feel really honored and humbled. So I always want to take out time and share whatever little I know with people around, with parents, because when it comes to pediatrics, when it comes to children's health, every father, every mother is anxious. You agree with me, right? Parents who are watching this now, every silly thing you get anxious, every small thing you get worried. Despite of opinion, sometimes it becomes very difficult to accept what is going on with your child, right? So today I am here to try and help you out with a few answers, whatever I could. In total, we have received about 138 questions from different social media platforms, from Instagram, from Facebook, from YouTube, right? So what I have done is a lot of questions are overlapping, a lot of questions are similar. So I have jotted down to about 46 questions, which I feel are pertinent, जिससे सबका फायदा होगा, जिसमें majority questions और answers cover हो जाएंगे, right? So without wasting much time, let's start with पहला question, जो बहुत common question है. I'm sure कि most of you will agree with this. इस season में fever, cold and cough in this season, how to handle, why is it happening so frequently? See, सबसे पहली important चीज़ मैं आपको बता दूँ, it is monsoon at most of the parts of India now. It's rainy season, right? तो monsoon में generally viral infections, allergies ज़्यादा होते हैं. Viral infections जैसे सर्दी, बुखार, खांसी. Majority of the children जो हम देख रहे हैं वो upper respiratory viral infections है. What is upper respiratory? मैं आपको briefly बता दूं. Upper respiratory मतलब नाक, गला, sinuses, ears, ये पूरा upper airway including throat. Okay? तो ये infections ज़्यादा हो रहे हैं, होते हैं, because ये viruses generally इस मौसम में, मानसून के मौसम में multiply होते हैं. नंबर 1. नंबर 2 रीजन क्या है? क्रॉस इन्फेक्शन ज्यादा हो रहे हैं. मतलब चिल्ड्रन आर गोइंग टू स्कूल नाउ, राइट? एवरीवेयर स्कूल्स हैव ओपनड अप एंड बच्चे स्कूल जाते हैं. एक बच्चे को सर्दी, बुखार, खांसी होती है, ही विल स्नीज, कॉफ, वो दूसरे को फैलाने के चांसेस ज़्यादा होते हैं. सो इनवेरिएबली स्कूल गोइंग चिल्ड्रन आर कमिंग टू अस वेरी फ्रीक्वेंटली विद सर्दी, बुखार, खांसी वगैरह, राइट? सो जैसे ही फीवर आता है, सारे पेरेंट्स परेशान हो जाते हैं कि फीवर आ गया है, राइट? सो मैं आपको ब्रीफली बता दूं, फीवर एक नेचुरल डिफेंस मैकेनिज्म है. फीवर आना ज़रूरी है, राइट? जैसे कोई बैक्टीरिया, वायरस कुछ भी बॉडी में एंटर करता है तो बॉडी कैसे रिस्पॉन्ड करता है? फीवर के जरिए रिस्पॉन्ड करता है. एंड नंबर 1, फीवर से क्या होता है? कई बैक्टीरिया, वायरसेस अपने आप मरते हैं. दे डाई ऑन देयर ओन. व्हेन द बॉडी टेम्परेचर राइजेस, this high temperature destroys a lot of bacteria and viruses. You understand? So this is a natural immunity of the body. रही बात खांसी सर्दी की, एक यूनिवर्सल क्वेश्चन है, नेवर सॉल्व्ड इसका आंसर है. खांसी बहुत तरह की होती है. एलर्जिक खांसी होती है, इन्फेक्शन खांसी होती है, निमोनिया खांसी होती है, ट्यूबरकुलोसिस की खांसी होती है, ड्राई खांसी होती है, वेट खांसी होती है, वगैरह वगैरह, राइट? सो इस फीवर के साथ आने वाली सर्दी, खांसी अपर रेस्पिरेटरी वायरल इन्फेक्शन से हो रही है. इस मौसम में बच्चों को ज्यादा हो रही है बिकॉज ऑफ द करंट सिचुएशन, राइट? हर एक वायरल इन्फेक्शन का इलाज एंटीबायोटिक से नहीं करना है, जरूरत नहीं है. आपके पीडियाट्रिशियन, आपके डॉक्टर डिस्कस करके आपको बताएंगे. इट्स अ सब्जेक्टिव केस. नाउ सेकंड क्वेश्चन इज फ्रॉम पुणे. कंजंक्टिवाइटिस इज स्प्रेडिंग इन पुणे, प्लीज एडवाइज व्हाट टू बी डन. नाउ लेट मी एक्सप्लेन. बहुत लोगों को आपको पता भी होगा कंजंक्टिवाइटिस का मतलब क्या है. आई इन्फेक्शन, आंख लाल हो जाती है, स्टिकी आईज होते हैं, इरिटेशन होती है, खुजली वगैरह वगैरह, राइट? यू मस्ट हैव सीन, उसको मेड्रास आई भी कहते हैं। फिलहाल कंजंक्टिवाइटिस लार्जली दो टाइप की हो रही है, एक एलर्जिक, दूसरी तीन टाइप की हो रही है, सॉरी, एक एलर्जिक, दूसरी बैक्टीरियल एंड वायरल। अभी जो मेजॉरिटी ऑफ द केसेस ऑफ कंजंक्टिवाइटिस आ रहे हैं दैट इज लार्जली वायरल। क्यों? बिकॉज सीजन ऐसा है, वायरल इन्फेक्शंस हैं, जिन बच्चों को सर्दी खांसी बुखार है उन लोगों को कंजंक्टिवाइटिस भी हो रहा है। ओके, सो क्या करना चाहिए? सी सिंपल है, एवरी कंजंक्टिवाइटिस एज आई सेड नॉट नेसेसरीली बैक्टीरियल है, तो एंटीबायोटिक का इस्तेमाल नहीं करते हैं। सिंपल कभी कभी आई ड्रॉप्स दिया जाता है ताकि सेकेंडरी बैक्टीरियल इन्फेक्शन, मतलब बैक्टीरिया शुड नॉट अटैक इन अ वायरल कंजंक्टिवाइटिस, नंबर 1। नंबर 2, आपको क्या करना चाहिए घर पे? ल्यूकवार्म वाटर से, मतलब एक कॉटन का सॉफ्ट कपड़ा ले लीजिए, ल्यूकवार्म वाटर में उसको सोक कीजिए एंड हल्का सा कीप क्लीनिंग द चाइल्ड्स आईज सो दैट वो स्टिकीनेस थोड़ा कम हो जाए, इरिटेशन थोड़ा कम हो जाए, राइट? एंड हाँ, डेफिनेटली वायरल कंजंक्टिवाइटिस है तो एक दूसरे को आ सकता है। अगर आपके घर में 2 3 4 बच्चे हैं, इट इज़ पॉसिबल दैट इट कैन स्प्रेड। कैसे स्प्रेड होता है? बच्चे ने आंख घसी और बच्चे ने कुछ टॉय पकड़ा, उसी टॉय को दूसरे बच्चे ने पकड़ा एंड ही टच्ड हिज आइज, राइट? सो ऐसे ये स्प्रेड होता है। नंबर 3, सो कंजंक्टिवाइटिस डेफिनेटली कॉमन चल रहा है, ऐसा नहीं कि सिर्फ पुणे में है, बैंगलोर में भी कंजंक्टिवाइटिस बहुत है, नॉर्थ से भी हमको कॉल्स आ रहे हैं, मैसेजेस आ रहे हैं। तो कंजंक्टिवाइटिस बेसिकली डिपेंडिंग ऑन द केस, अकॉर्डिंगली वी डू द ट्रीटमेंट। Number 3 question, my son is 5-year-old and he rubs his eyes. Is it normal? 5 साल का बच्चा है and he rubs his eyes. See, eye rubbing is also part of allergy. जैसे बच्चों को अगर रेस्पिरेटरी एलर्जी है, एलर्जिक कोल्ड है, एलर्जिक कॉफ है, तो आंख की भी एलर्जी होगी. He keeps rubbing eyes like this. He can even itch his ears. And he'll have जैसे गले में खराश होगी, राइट? सो आई रबिंग कैन बी पार्ट ऑफ एलर्जी. अगर उसको आंख में रेडनेस नहीं है, स्टिकी म्यूकस नहीं है, तो नथिंग टू वरी, इट कुड बी जस्ट एलर्जिक राइनाइटिस. कुछ नेजल स्प्रे से, कुछ एंटी एलर्जिक मेडिकेशन से दैट विल कम डाउन ऑन इट्स ओन. अगेन सीजनल अटैक रहेगा. Okay, and fourth question is discuss the nutrition for pregnant mothers. My in-laws are very mean. Well, पता नहीं ये किसने भेजा है. अब in-laws की बुराई मैं नहीं करना चाहता लाइव में आके, मुझे पंगे नहीं लेना है बॉस. Well. See, if you are pregnant, definitely आपका कैलोरी इंटेक बढ़ेगा. You will have to take close to about 500 to 800 kilocalories more compared to regular calories, right? So आपको ज़्यादा प्रोटीन लेना होगा, ज़्यादा कार्बोहाइड्रेट लेना होगा, ज़्यादा विटामिन्स और मिनरल्स के फूड्स लेने होंगे, राइट? एंड ऑफ कोर्स हेल्दी होममेड फूड्स का मैं सजेशन दूंगा. एंड डिपेंडिंग ऑन योर वेट, डिपेंडिंग ऑन योर एनी अदर इश्यूज लाइक डायबिटीज़ है, आपको कुछ है, आपका BMI कितना है, उसके ऊपर डिपेंड होगा. आपके गायनेकोलॉजिस्ट एंड न्यूट्रिशनिस्ट आपको डिटेल में समझाएंगे. बट हेल्दी होममेड फूड्स अगर आप फॉलो कर रहे हैं तो डोंट वरी एंड डोंट ब्लेम और डोंट डू एनी इश्यूज विथ योर इन-लॉज. ओके, आराम से रहिए, शांत रहिए. आप प्रेग्नेंट हैं, ब्रीद इन ब्रीद आउट, काम. बच्चे पे नेगेटिव असर होगा. ओके, सो ओके, नेक्स्ट क्वेश्चन इज आई एम फ्रॉम हैदराबाद, want to know about healthy foods and about this winter season for my children. See, as I said, I always keep mentioning about nutrition for children, right? Healthy foods बहुत ज़रूरी है बच्चों के लिए, especially school going बच्चों का प्रोटीन रिक्वायरमेंट जैसे देखा जाए तो सी प्रोटीन रिक्वायरमेंट के हिसाब से आप न्यूट्रिशन एटलीस्ट प्लान कीजिए, बिकॉज दैट विल हेल्प देम ग्रो टॉलर, मसल ग्रोथ सब हेल्प करेगा. जैसे 1 to 3 ईयर बच्चों के लिए अराउंड 10 to 13 grams ऑफ प्रोटीन पर डे, 4 to 8 ईयर्स बच्चों के लिए अराउंड 20 grams ऑफ प्रोटीन पर डे, एंड फ्रॉम 9 to 13 ईयर्स बच्चों के लिए अराउंड 30-35 grams ऑफ प्रोटीन पर डे, एंड बड़े बच्चों के लिए 15 साल के ऊपर बच्चों के लिए 50 grams ऑफ प्रोटीन पर डे. ये एक रिक्वायरमेंट है. उस हिसाब से आप जो बॉइल्ड एग दे रहे हैं, आप टोफू दे रहे हैं, आप नट्स दे रहे हैं, आप ग्रीन वेजिटेबल्स दे रहे हैं, आप फ्रूट्स दे रहे हैं, मिल्क प्रोडक्ट्स दे रहे हैं, उस हिसाब से यू प्रोवाइड राइट न्यूट्रिशन. सो मेक श्योर जंक फूड हो, अनहेल्दी फूड हो, मील से पहले ऑफर मत कीजिए. इफ़ यू डू दैट बिफोर मील्स, बिफोर लंच, बिफोर डिनर, बिफोर ब्रेकफास्ट, आपका बच्चा बच्ची खाना नहीं खाएंगे. बिकॉज वन पीस ऑफ चॉकलेट उनका शुगर थोड़ा बढ़ा देता है और ब्रेन को ये मैसेज देता है कि मेरा पेट भर गया है, योर टमी इज फुल, यू डोंट नीड टू ईट मच. सो अवॉइड sugary and unhealthy foods before meals. Remember that, okay? And इस सीजन में जैसे मैंने बताया, इस सीजन में you have to keep the children warm, maintain hygiene, teach them hand wash, teach them frequent hand wash. See, 70% of infections can be prevented अगर आप बार बार मतलब लगातार रेगुलरली हैंड वॉश करेंगे, बच्चों को हैंड वॉश सिखाएंगे. क्यों ये ज़रूरी है? खेल के आएंगे, कुछ खाएंगे, वॉशरूम से आएंगे, कुछ मुंह में रख लेंगे, स्कूल में कुछ खेल करते रहेंगे, दिल पिक अप एंड ईट, कुछ खाते खाते बिस्किट ड्रॉप, पिक अप एंड ईट. सो वी हैव टू टीच देम, ट्रेन देम अबाउट हाइजीन एंड हैंड वॉश. नंबर 2, इस सीजन में आपने पूछा सवाल, इस सीजन में रेस्पिरेटरी इलनेस के सीजन में रेस्पिरेटरी हाइजीन का इंपॉर्टेंस यू हैव टू टीच देम. इन द सेंस व्हाट यू हैव टू डू, यू हैव टू टेल देम. 2 साल 2.5 साल के ऊपर बच्चों को आप सिखा सकते हैं. एवरी टाइम यू कॉफ और स्नीज, cover your mouth and nose with elbow. You understand? Not with palms. क्योंकि क्या होगा, बच्चे पाम में छीकेंगे, हाथ में छीकेंगे तो उसी हाथ से हैंडशेक करेंगे या हाई फाई देंगे या जो भी होगा, राइट? सो टीच देम अबाउट रेस्पिरेटरी हाइजीन टू कवर इट while coughing and sneezing, right? That you have to take in this. Number 6, मेरा बेटा कुछ भी खुश होकर नहीं खाता है. वाओ, क्या सवाल है ये. सवाल आई एम श्योर एवरी मदर, एवरी फादर का होगा कि सही है डॉक्टर साहब, मेरा बेटा कुछ भी नहीं खाता, ही डजंट ईट एनीथिंग. एनीथिंग, दे से लिटरली एनीथिंग. सी, यू हैव टू अंडरस्टैंड, बच्चों का खाना पीना डजंट डिपेंड ऑन न्यूट्रिशनल वैल्यू. इट डजंट डिपेंड ऑन कि हाँ भाई ये खाने से मेरे को सेहत मिलेगी, ये खाने से मेरे को मेरा हाइट बढ़ेगा, ये खाने से मेरा नो. उनका एक ही सवाल होता है, इज इट टेस्टी, इज इट डिलीशियस, इज इट यमी, राइट. सो अक्सर क्या होता है, अगर आप ऑब्जर्व करेंगे, मेजॉरिटी ऑफ द बच्चों का, ऑफकोर्स हर बच्चा यूनिक होता है, मेजॉरिटी ऑफ द बच्चों का आप चावल दीजिए, राइस दीजिए, रोटी दीजिए, फ्रूट्स दीजिए, दे मे नॉट बी शोइंग ग्रेट इंटरेस्ट. नहीं मुझे नहीं चाहिए, ज़बरदस्ती आप करोगे, उसके पीछे भागोगे, खिलाओगे, राइट. एंड ही और शी मे हैव सम पर्टिकुलर इंक्लिनेशन एंड इंटरेस्ट टुवर्ड सम पर्टिकुलर जंक फूड. उसको पास्ता पसंद है, उसको पिज्ज़ा पसंद है, उसको कुछ केक पेस्ट्री पसंद है, वो मज़े से खाता है, चॉकलेट दे दो मज़े से खाता है. सो देर विल बी सम इंक्लिनेशन टुवर्ड्स सम काइंड ऑफ फूड्स विच ही फाइंड्स प्लीजिंग, विच ही फाइंड्स टेस्टी एंड यमी. सो ये होता है. लेकिन मैं एक ही बात कहता हूँ सब पेरेंट्स से कि आपके बच्चे का हाइट, वेट, माइलस्टोन्स, ओवरऑल फिजिकल डेवलपमेंट अगर नॉर्मल परसेंटाइल में है, आफ्टर टेकिंग ओपिनियन फ्रॉम ए पीडियाट्रिशियन, अगर वो नॉर्मल परसेंटाइल में है, so do not worry, do not force feed, do not push him or her. आप बच्चे को उसको नफरत हो जाएगी खाने से, फूड फोबिया हो जाएगा, अवर्शन हो जाएगा, एक हेट्रेड पैदा हो जाएगा. आप जब भी वो फूड लेके आएंगे वो चीखेगा, चिल्लाएगा, भागेगा. सो डू नॉट डू दैट. ऑफर देम, टॉक टू देम, मेक देम अंडरस्टैंड, थोड़ा गैप बढ़ाइए. एंड जैसे मैंने दोबारा कहा, प्री मील जंक फूड डू नॉट ऑफर, उससे भूख मर जाती है, राइट. सो मेक श्योर यू डोंट डू दैट. सो प्लीज वॉच चाइल्ड क्या खा रहा है बीच में, बिटवीन मील्स क्या जंक खाता है, ठीक है. वी आर फ्रॉम गल्फ एंड माई 4-year-old डजंट पास स्टूल्स रेगुलरली एंड डॉक्टर हैड सस्पेक्टेड Hirschsprung's disease and was ruled out later, suggested surgery, then I took a second opinion. They said surgery not required. लेकिन अभी भी constipation है, अभी भी वो stools irregular pass करता है. And according to this lady, उन्होंने first 24 hours में after birth he had passed stools. Okay. So देखिए, Hirschsprung's disease एक intestinal disorder है. कुछ neuronal cells, कुछ nerve cells की कमी से Hirschsprung's होता है. Hirschsprung में क्या होता है, बच्चे को stools will be irregular. जैसे बच्चा पैदा होता है, within 48 hours of birth he or she should pass stools. 48 घंटे में stools should be passed, right? In Hirschsprung's disease, they may not pass stools within 48 hours, and there may be bloating, there may be vomitings, ये सब होते हैं. और बड़े बच्चों में क्या होगा, कॉन्स्टिपेशन में होगा. खैर, Hirschsprung's डिसीज का अगर आपको कंफर्मेशन करना है तो बायोप्सी से होगा, राइट. दे विल टेक ए टिश्यू फ्रॉम द इंटेस्टाइन, दे विल डू ए बायोप्सी एंड दे विल कंफर्म वेदर ही और शी हैज Hirschsprung's डिजीज. अगर नहीं है, अगर आपको लग रहा है कि हाँ ही इज जस्ट हैविंग इरेगुलर स्टूल्स एंड हार्ड स्टूल्स, then it could be just a functional constipation syndrome जो majority बच्चों को है, majority of children have, especially toddlers have functional constipation because of multiple reasons: irregular meals, less intake of water, hereditary, so more of junk, less fiber, so on and so forth, right? So this could be a case of one functional constipation syndrome. Let me tell everyone here, constipation is हर घर की कहानी है. It's everybody's story, every house story. Invariably, children first 5 years go through constipation. So constipation treatment is also very aggressive, sometimes long standing, right? You have to give laxatives, you have to give suppositories, you have to give sometimes even enemas, depending on the severity of the case. Okay, constipation treatment, do not ignore. But Hirschsprung's, definitely you have to confirm by rectal biopsy, which your surgeon will guide you, right? Next is suffering from pharyngitis since 2 months. Please suggest precautions and treatment. See, my dear friend, pharyngitis cannot last for 2 months. Pharyngitis means once what? It's a throat infection. The throat ka jo wall hai, it gets inflamed and infected. So pharyngitis, on what basis are you saying pharyngitis for 2 months, right? So because pharyngitis usually 5 days, 7 days, maximum 2 weeks tak rehta hai, where you'll have throat pain, you'll have fever, you'll have difficulty in swallowing, so on and so forth. If you're saying 2 months, then definitely has to be investigated. How to prevent? Of course, you take care of your hygiene, take care, avoid drinking, extremely cold drinks outside, and make sure you are drinking lukewarm water if you're traveling, and hand wash frequently, gargling in between if you feel some irritation and itching. Of course, antibiotics if it is a bacterial pharyngitis confirmed, right? Next question is, please make a video on diet for children and toddlers, balanced diet for toddlers. This, as I said, balanced diet is everybody's dream, is every parent's wish, and dream रहता है कि my son or daughter should eat proteins, carbohydrates, fats, vitamins, minerals in a balanced way. Number one question is, are you yourself as a parent taking a balanced meal? I want to ask myself, am I taking a balanced meal? बच्चों का फूड हैबिट्स तो एक तरफ है, it will be challenging to make the child eat healthy, home cooked foods and all that, but also a lot depends upon how as parents we eat our meals. How is our plate? How does our plate look? What kind of carbohydrates, what portion of fats, what portion of proteins, what portion of fiber diet is there in our plate? Do we eat together as a family? Do we eat regularly? These things, a lot of things come into picture, because I can't just tell you कि हाँ बच्चों को balanced meal 1, 2, 3. You can find it on Google, right? That's easy. But my point here is, you want to make your child eat regularly, eat healthy meals. Don't be fussy. A lot of things we as parents have to do, right? We have to throw our mobile phones and sit together as a family. Meal time, right? Talk to children about importance of food. Give them the food with the quantity which they can finish. Do not have over expectations. Do not say कि हाँ इतना खाना चाहिए इसको, boss ये 3 साल का है, इतना तो portion, Do not do that. A lot of parents make, they just stuff the entire plate with so much of foods, vegetables and blah, blah, blah. And invariably child would leave half of it and he may even puke, right? So don't do that. According to age specific, you have to, fill his plate. Sit together on the dining table. Discuss the importance of food every time. Talk to the child about why is this carbohydrate important, why is this vegetable important, why are this, what will rice give you, how much of protein there in this boiled egg, how much of minerals. You can just find out and just give him or her. See, that will give him some information that can excite him or her, or she will look into the food, enjoy the food. Avoid mobile and television while eating. It's not difficult. Parents say नहीं खाता है, बहुत मुश्किल है. 20-25 साल पहले मोबाइल टीवी नहीं था, एंड आवर पेरेंट्स फेड अस चिड़िया दिखा के, आसमान दिखा के, तारे दिखा के, पता नहीं क्या क्या दिखा के, बट दे स्पोक टू अस एंड दे डिड दैट, राइट? सो वी मेक इट कॉम्प्लिकेटेड. डू नॉट डू दैट. इट मे टेक फ्यू डेज, इट मे टेक वीक्स टाइम. आपको लगता है कि नहीं खाएगा नहीं, नो प्रॉब्लम. दैट डे लेट हिम और हर नॉट ईट. नथिंग विल हैपन. हर पेरेंट को ये लगता है कि बॉस आज नहीं खाया खाना तो क्या हो जाएगा. कुछ नहीं होगा. कुछ नहीं होगा. His metabolism is different, not like yours and mine. You understand? So avoid these gadgets, especially during meal. Engage with toys, it's okay. Some books, it's okay. Tell him some stories, it's okay. Don't use gadgets, okay? That will only cause damage. All right. So next is okay. मेरे बेबी का लर्निंग पावर बहुत वीक है. 4-5 सेकंड में भूल जाता है. 50 बार राइटिंग करवाती हूं, बाप रे, तब जाके याद रहता है. कोई टिप्स बताइए. देखिए, बच्चों में अक्सर देयर इज समथिंग कॉल्ड एज सेलेक्टिव मेमोरी. सेलेक्टिव मेमोरी होती है. क्या है सेलेक्टिव मेमोरी? खैर, इनका केस आई डोंट नो इन डिटेल, मैं आपको एक जनरल आइडिया दे रहा हूं. What is selective memory? Most of the children would remember certain character from television, certain from some sweet shop, few friends' birthdays, or few friends' names, or few famous songs, or few famous locations, and few famous foods, or whatever. पढ़ाई में, when it comes to something which is not of their interest, I don't like it, so I don't want to remember it. You ask yourself, how many mobile numbers can you as a parent remember today? But how many movies, how many songs, how many characters, or how many food items in somebody's wedding, buffet, आपको याद रहेगा. So something which is of not of great value, वो भूलते हैं, right? So obviously it is not easy. मैं बैठ के यहाँ पे लेक्चर झाड़ सकता हूँ कि obviously parenting is not easy. Obviously बच्चों को पढ़ाना is not easy. So what I'm trying to say is find out कि क्या उसको दूसरी चीज़ें याद रहती हैं, क्या वो दूसरी चीज़ें भी भूल जाता है, क्या वो जनरल उसकी मेमोरी ही वीक है, उसको किसी फ्रेंड्स के नाम याद नहीं रहते हैं, उसको किसी इवेंट के बारे में याद नहीं रहते हैं, उसको किसी प्रोग्राम के बारे में, देन इट्स ए प्रॉब्लम. Then definitely it's a problem. You have to evaluate the child. And अगर वो selective memory है, then वो majority of बच्चों का issue है. You have to just spend time, make it fun. सीखने को थोड़ा entertaining बनाओ, थोड़ा engaging करो, थोड़ा आप भी सिखाओ, आप अलग स्टाइल से सिखाओ. तो उसमें you might find some solution. Okay. Kerala से somebody has asked, my son is 9 years, his weight is 21 kgs, वो 4th standard में है. How to increase his weight? देखिए, हम इंडियंस, और आई डोंट नो ये क्या है, एशिया का प्रॉब्लम है, ये साउथ ईस्ट एशिया का प्रॉब्लम है. मोस्ट ऑफ अस आर कंसर्न्ड अबाउट चिल्ड्रंस वेट, राइट? मोस्ट ऑफ देम, मतलब 90% ऑफ देम हम यही बोलते हैं कि भाई वेट बढ़ाओ, बस आई डोंट केयर अबाउट एनी, वेट बढ़ाओ. सो सी, एवरी चाइल्ड इज यूनिक. मैं आपको बता दूं, फर्स्ट ऑफ ऑल रिसेंटली मैंने एक वीडियो बनाया था कंपैरिजन के बारे में. नेवर कंपेयर चिल्ड्रन विथ ईच अदर. इवन सिबलिंग्स, इवन ट्विन्स, डू नॉट compare it with each other, right? So when it comes to a child, lot of things come into picture. His milestones, his mental abilities, his, of course, physical growth, his height, his overall performance, his IQ, his social behavior, which is the biggest thing today. इसकी social health, मैं कहूँगा इसको social health बहुत ज़रूरी है. स्पेशली कोविड के बाद बहुत से बच्चों का सोशल लाइफ बिगड़ा है, सोशल हेल्थ बिगड़ा है. तो हम लोग सिर्फ वेट पे ही करते हैं. अगर बच्चा एक्टिव है, इफ ही इज प्लेफुल, इफ ही इज फिजिकली फिट, एक्टिव, he participates in sports and he runs, he plays, he doesn't sit at one place, Dr. Saab, he always very active, energetic. So 2 to 3 kilos underweight is not an issue at all. Please remember that. Active children, playful children, milestones are normal, no other issues, learning ठीक चल रहा है, social behavior ठीक है, no other health issues after examining with your pediatrician. Do not worry about it, because weight is something which is not a constant, which is not a it's a variable thing, right? Height is something which is permanent. Check such children's height and overall other development, right? Weight आज 2 किलो गेन होगा, अगले महीने 2 किलो लॉस हो सकता है. सो डोंट ब्रेक योर हेड अबाउट वेट. He may look 1 or 2 kilos on the underweight depending on your I don't have any other details about his birth weight and all, but as I said, child's overall performance, overall growth, overall his vitality is very, very important, not just weight. So moving to next question, how to start weaning. Very, very important question, very relevant question, especially for new mothers, first time mothers. How to start weaning? तो weaning क्या होता है? Weaning is a process of starting solids and slowly moving from breast milk towards solid food. It starts usually by about 6 months of age, right? So weaning, ideally speaking, should be started with soft Now they also are asking baby-led weaning. Is it good? Baby-led weaning is excellent. There is no doubt about it, right? What is baby-led weaning? We let the baby eat he or she by himself, right? Easily digestible or soft ones. Carrot, steamed carrot sticks, potato chips, steamed potato slices, broccoli steamed, something finger foods type. You offer the baby and baby can eat on its own. So weaning starts by about 6 months. I would suggest start with soft, easily digestible purees like fruit purees, vegetable purees like your mashed potato purees, sweet potato purees, broccoli, carrot, etc. Tapioca is very good. Fruit purees like apple puree, banana puree, avocado, papaya, mango if it is available still, excellent. And otherwise you can also start with single grain porridges, single grain ragi porridge. You can start with the rice khichdi, rice ki kheer, etc. So go slow, 1 or 2 meals in a day, and continue breastfeeding along, or formula feeding if you're giving. So month by month cut down on breastfeeding by one and add additional meal by replace that by one, right? So slowly continue the weaning process, and make sure, one more point I would like to add, make sure any food you introduce, कोई भी नया food you introduce, 3 days you have to give that food, because we need to watch for any signs of reactions or any signs of digestive issues among children, right? तो आप 3 दिन same food देना है, especially new food, before introducing the next food, right? So that's how the weaning process starts. Every child is unique, so don't try to force feed and don't try to add multiple foods when you start, right? How to increase hair in infants? You don't increase the hair in infants. It will increase on its own. What do you want to do? भैया बच्चा पैदा हुआ है. Initially there will be sparse hair, there will be less hair. There also will be hair fall first year of life, and slowly hair will come. And let me also add here, majority of parents shave multiple times, right? Have you done that? Multiple times. First year में 3 से 4 बार keep shaving. बाल नहीं आ रहे हैं. अरे बाल आ रहे हैं, आप आने नहीं दे रहे हो. You're just shaving. So don't do that. First year hair growth is very unique to every child. Also hereditary matters, hereditary cases, effect is also there. But you don't do anything. Use decent, nice, any shampoo which is recommended by a doctor. Give 3 to 4 times in a week shampoo wash. Normal regular nutrition what you're giving. Naturally hair will come, whatever the nature has decided, hereditary has decided. So don't do anything. My son is 13 months. There are white patches on the lips. Taking treatment from skin specialists, but I'm worried if it spreads all over the body. See, white patches on the lips, in the mouth could be something called as candidial infection, fungal infections में होता है. And if you already met your dermatologist, great, continue the treatment. Don't worry about spreading here and there. If it is local oral, it should remain confined to the oral cavity and lips. अगर कुछ white patches आपको body पे दिखते हैं, then definitely you will have to take an opinion. Okay, hi, I am Kavita. My children get cold and cough whenever the season changes. Yes, Kavita, this is a viral season. This is allergic season as well. Some children have a tendency to get frequent cold and cough. Allergic rhinitis, reactive airway disease, जिसे कहते हैं, where children, if exposed to little dry, windy air, weather, cold weather, they may cough easily, they may sneeze easily, and this will definitely be affected by weather conditions. Dust, smoke also. Some children may have dust allergy, smoke allergy also, and such children, majority of such children, with age it comes down. अगर allergic rhinitis है, respiratory allergies हैं, as the children grow, the symptoms and severity comes down. So individual case matters. We'll have to examine and then evaluate and tell you as to what it is, right? मेरा बेटा 27 month का है, birth weight 2 kg था, अब 9 kg का है. ज्यादा है कि कम है? Weight is perfect. आपके बेटे का weight, birth weight 2 kg था, तो I would say 2 kg birth weight था, तो he's almost appropriate for his birth weight. अगर आप दूसरे बच्चों को कंपेयर करेंगे तो he may look a little on the lower side because 27 months he is. If जैसे मैंने बताया, he's about around 27 months, right? Yeah, 2 years 3 months. So उसका माइलस्टोन्स, यू जस्ट हैव टू वॉच हिज माइलस्टोन्स. नाउ 2 years कुछ वर्ड्स बोल रहा है, कुछ बातें कर रहा है, कुछ समझता है, सोशल स्माइल करता है, देखता है, आई कांटेक्ट करता है, बच्चों के साथ हाई फाई देता है, खिलौने एक्सचेंज करता है, इंटरेक्ट करता है. These things are very important. Weight 9 kg, birth weight के हिसाब से it is fine, don't worry. Any chance to cure type 1 diabetes? Any lifestyle changes? See, type 1 diabetes, जो juvenile diabetes कहते हैं, this is unfortunately seen in children. Lot of reasons, in the sense there is no clear cut reason. जरूरी नहीं कि पेरेंट्स को डायबिटीज है तो बच्चों को होगा. It could be genetic, it could be the molecular level. Well, cure, I'm sorry, I cannot comment about cure, because as till date, as of now, there is no cure for type 1 diabetes, because it will be there. There's a system failure of insulin and sugar regulation का जो ये है system है, that is somewhere deranged. So hence childhood diabetes is seen. It's called a juvenile diabetes. So he or she has to be put on insulin, and for how long we don't know. But lifestyle shouldn't be a problem. I myself had a batchmate during my MBBS days. He had juvenile diabetes, and let me tell you, he was extremely fit. He he used to go to gym, and he used to work out, and he used to look healthier than the rest of us. So I've seen many of such cases. So don't worry about lifestyle thing. Don't demotivate your child, or don't look depressed in front of your child कि उसको diabetes है. Have a positive and healthy lifestyle. Of course, follow the instructions of your endocrinologist or pediatrician. उनका insulin dose में don't go for shortcuts or alternative therapies कि किसी ने बोला कि भाई ये खिलाओ diabetes चला जाएगा. Do not do that. Don't take risk when it comes to him. But definitely it might take really, really long time, and we don't know when he or she will be out of the diabetes. Nowadays, kids are not obeying us. How to discipline them? वाह डैडी. किसी डैडी ने बोला है कि बॉस बच्चे सुनते नहीं हमारी, क्या करें? हाउ टू डिसिप्लिन देम? अगेन मेरा आपसे सवाल है कि आप बच्चों को डिसिप्लिन करवाना चाहते हो, राइट? ठीक है, बच्चे आर tantrums, they don't listen, they run around. Let me tell you one thing, kids will not do what you ask them to do. They will do what you do. Okay? So we need to see first ourselves how disciplined in generally about eating habits, about sleeping habits, about mobile habits, about our language, how we talk to each other, how we talk to people in the society. How patient are we when it comes to aggressive situations, when it comes to some tension situation? How are we dealing? So बहुत चीजें यहाँ पे मैटर करती हैं. Of course, as I said, you have to be calm and patient first and foremost. You have to calm down. The more aggressive you get, the more you lose temper, the tougher it is for you and for your child. You have to calm down, you have to stay calm, you have to talk to your children, and more importantly, lead by example. If you're asking your child to go to bed early, you go to bed early. At least you have to fall asleep with the child. People come tell me that Dr. Saab 2 बजे तक रात के खेलता रहता है, सोता नहीं है. I ask them, what time do you sleep? We sleep by around 12:31. See? The child doesn't care. Child wants to sit with you and play with you, boss. You have work on the office, or you're watching TV, you're on mobile or reading, doesn't matter. He just doesn't want to sleep. So we have to be disciplined. We have to change as we become parents, right? We can't just lecture somebody, okay, you do this, you do that, khao, sabzi khao. You have this thing, and you yourself, your plate is full of junk, for example. And you're holding mobile and saying, enough, don't watch mobile. And boss. So discipline is, I'm not a parenting expert, or I'm not a great psychologist, but what I'm trying to say is, as a father myself, I have experienced this, and I'm going through this on a daily basis. The child will ask you a question, but you did that, but you're not doing that, but you're not eating this, but you're walking in this direction, but you don't wear seat belt, but you're eating junk. So please be prepared. So you cannot just discipline them. It has to be a team effort, and it has to be done very, very patiently, right? Okay, next is baby has frequent stomach infections and cold. He's crawling and teething also. How to prevent this? See, your question has got answer in the question itself, right? Your baby must be around 10 months, 9 months, I presume. Now, he has frequent stomach infections. Naturally, a baby who's crawling and teething has an irresistible urge to keep everything in the mouth, right? That is called as mouthing. कुछ भी मिला मुंह में, पेन मिला मुंह में, टॉय मिला मुंह में, चप्पल मिला वो भी मुंह में जाएगा, right? So obviously the child is taking so much of germs and bacteria and all that in the tummy. So stomach infections are very different. How to prevent it? See, mouthing you should not prevent. Mouthing is a natural process. वो बच्चा मुंह में लेगा, that's a natural process how they grow. So don't try to pull his hands out. But make sure that area is clean and hygienic. Make sure that he or she is not crawling somewhere in the washroom, somewhere near on the some dirty carpet or doormat or something like that. Just make sure those things. Cold तो खैर वो seasonal है, and बच्चों को होगा ही होगा. Don't worry about cold, right? My baby is 18 months on breast milk, not taking cow's milk. Birth weight was 2.9 kgs. Now it's 8.7 kgs. Is breastfeeding the reason for not gaining weight? How to stop breastfeeding? See, 18-month-old baby, birth weight being 2.9, 8.7 is slightly on the lower side. Definitely yes. But yes, your question is definitely valid, and probably yes, that breastfeeding, now 18 months means he should be taking, of course breastfeeding has got its own importance, its own role. You have to feed your child, but it should not be more than 20% of his total meal requirement. You understand? Agar total whatever foods he's taking, breastfeeding should be only 20%. So you now have to see how often does he breastfeed, how much is he drinking, how frequently is he drinking. Many a times it so happens that children who get little addicted to breast milk, they don't eat anything, they're hungry, they're cranky, they're restless, they want mother's milk. ऐसा केस है तो definitely that could be one of the reasons of him not gaining weight. So you'll have to slowly cut down. And how to stop breastfeeding? There is no rocket science, there is no 6 months course, there is no certification course IIM से आपको करना है कि कैसे breastfeeding stop करें. It again requires a lot of patience and being firm. You have to, as a mother, draw the line. It is difficult, yes, especially if you are staying in a joint family. It might be challenging. He's crying, she's crying. You said, "अरे दूध पिलाओ यार, वो रो रहा है." It's okay. डॉक्टर हो गया भाड़ में, तुम पिलाओ. हम बोल रहे हैं दूध पिलाओ. So it might be difficult, but that's how the weaning process works, right? If the child is not gaining weight, fussy eating, you have to draw the line. Let him cry, let her cry. Do not offer it so frequently. Let that gap be more. जैसे if you're feeding every 3 to 4 hours, make it 5 hours, 6 hours gap between to feed breastfeeding to next breastfeeding, so that the hunger cramps come and eventually he or she would eat whatever you offer. So it may take a couple of weeks, but you have to be firm. Do not give up. जोश में शुरू करते हैं, फिर बच्चा रो रहा है, ये कर रहा नहीं सुन रहा वगैरह वगैरह, they again get back to the same 5 to 6, 8 times feeding, especially day and night. So don't do that. You have to be a little soft, gentle, but firm. Okay. My baby is 3.5 months. Oops, greenish. Why? He's taking vitamin D3 and weight is 5.9. Your baby's weight is excellent. I presume that baby is on exclusive breast milk. Every green stool is not infectious. Let me tell you that. हर green stool infection नहीं होता है. Right? Vitamin D and supplements, sometimes if the child is taking supplements, might pass green stools and greenish yellow stools. Don't worry much about it as long as baby is gaining weight well, baby is active, no mucus in the stools, no blood stains in the stools, no fever, nothing. So don't worry about just simple greenish stools. अगर formula fed है तो definitely greenish stools रहेगा. My 13-year-old son is bleeding while he is के बाद उन्होंने टॉयलेट सीट का पिक्चर डाला है. ओके, माय 13-year-old son is bleeding while he is टॉयलेट सीट का पिक्चर. अभी मुझे पता नहीं कि ये सुसु के टाइम पे ब्लीडिंग है कि पोटी के टाइम पे ब्लीडिंग है, राइट? सो अगर if he's bleeding while passing urine, then definitely it's a matter of significant concern. It could be severe UTI, urinary tract infection. It could be anything, cystitis, anything. You have to get the child evaluated. अगर ये stools का bleeding है, then it could be severe constipation, it could be local ulcers, it could be sometimes any intestinal bleed as well. So get the child evaluated, get his stool test done, stool culture, stool test done, and also get the child examined by your doctor, right? My daughter is 21-month-old. Water comes out of her mouth while sleeping, and she puts everything in her mouth. 21-month-old teething process is going on, salivation will be going on when they're sleeping. Obviously, salivation. अरे बच्चों का छोड़ो यार, many adults will have salivation while sleeping, right? There are deep sleep, snoring, and they'll have. So that's not a major issue. And again, put everything in the mouth is a mouthing, is a routine habit. Starts by about as early as 3 to 4 months and 6 months and goes on till about 2.5 years. So that now by 2.5 years you'll have to watch what things he or she putting and slowly try to control if it is dirty or unhygienic. How to start weaning? I think I just answered that. Sorry. Oh, sorry. This is done. I'll move on to the next question. My baby is 3 years and often says leg pains at night. 3-year-old is a toddler child. Leg pains at this age is extremely common. It's called as growing pains because your tendons, muscles, ligaments, bones are growing, especially at night they grow, and whole day they play, they run, they are active. So रात को pain होगा. Gentle massages. अगर calcium supplement नहीं दे रहे तो you can give calcium supplement. In severe pains, you can also use some painkillers occasionally. But that is growing pains. Don't worry about it. How do you treat colic? See, infantile colic, if you're talking about infantile colic, is very common. Children, especially 3 to 6 months, they cry incessantly, especially at nights. They get colic pain, they get severe pain, abdomen, they cry. So colic you can treat by burping well. After feeding, make sure that you burp the child very well and place the child on the tummy, at least give tummy time, basically 5 to 6 times in a day. And despite of that, colic is severe, then some medications to soothe to reduce the pain might be required. Individual case depends. How is the child feeding? How is the child weight gain? How is there any reflux? How many times the child is throwing up? Everything matters. So otherwise, we treat the colic according to subjective case. Why? Okay, this is a very interesting question. Why is immunization done? Why is vaccination done? Rather, why not emphasize on developing immunity? Why is paracetamol administered? Doesn't reducing fever undermine the whole purpose of vaccination? Brilliant. Why fever considered as sickness? Isn't it nature's way to fight? Brilliant. Okay, half of your question I definitely agree with you, and other half let me just try to clarify. Now, why immunization is done? See, immunization is a process of imparting immunity against particular disease, right? Whether it is viral, bacterial, fungal, few infections, right? So why not children get natural immunity? Excellent, they should get natural immunity. Now my question is, now we do wear helmet while riding bike. Why do we wear helmet while riding bike? Let us fall naturally. Let us get hurt a little bit here and there. On the skull is very strong. It's a strong one in the body. So let us fight naturally. Let get immune. Let the skull protect the brain. What would you say? It doesn't make sense, right? Vaccinations are there against some fatal, if not fatal, some severe infections which may sometimes, rarely even kill a child. If not, sometimes can cause major sickness and debilitation to children. So vaccine, for example, polio. Now, would you want any child get polio? Would you want any child get polio? Would you say, no, let him fight naturally and let the polio virus come. Let his body fight polio virus and kick it out. Would you say that? No, right? So, because polio it's permanent. The disability is permanent. The nerves are destroyed. The child cannot walk properly. The child is... Now, where do you see polio now in India? How often do you see? Where do you see, oh, child, usko polio hua hai? Have you heard? Have you read in the paper somewhere? What has happened in the past few years? Science has advanced, healthcare has advanced, come in a long way, and vaccinations have come. They're preventing a lot of such debilitating and fatal and life-threatening infections. So vaccinations definitely not compulsory. As a parent, you have to take a call. As a parent, are you ready for your child to get typhoid fever and he or she goes to school and fight it out and survive? Typhoid, there may be about 10,000 children dying in India annually, right? So are you ready to take that risk is the question you should ask. No one can compel you to do that. No one can compel. You can fight your own, point. But that's my point as to if you are ready as a parent, excellent. That's not a compulsion. But you have to think, well, helmet, pehnana hai, nahi pehnana, right? And your question, paracetamol, yes, fever is protective. Fever comes to protect the body. Fever, brain produces fever so that the infection goes away, viruses die. Definitely, paracetamol every time is not necessary. Paracetamol, I tell parents, The moment they see 100 degree, they just start pumping, medications, paracetamol, ye wo. I said, wait calmly, 2 to 3 days. Of course, you can give medications if it is more than 100 degrees, if child is looking very tired. But you have to be patient, because fever has come to protect the child. Don't rush for antibiotics, don't rush for blood tests, or don't rush for unnecessary investigations. So during vaccination, fever, definitely some vaccinations do produce fever. And just by giving paracetamol, the effect of vaccination is not diluted. The effect of vaccination is not, reduced or removed by giving paracetamol. It only reduces the fever. It does not kill the effect of the vaccination. मेरे बेटे को फीवर आता है, सर गर्म होता है. Definitely, when fever comes, children will have head warmer than body, because their metabolism is high, and generally head blood circulation is more. Child sometimes may be crying. Child generally is active. The head is generally warmer than body. When fever comes, head becomes more hotter. How do you how do you manage your mood throughout the work and with every patient? See, if you love what you do, you don't have to manage your mood, right? You don't get irritated. I just go there and have fun. I don't work, I just have fun. I enjoy it every child. You've seen my videos, right? I just keep having fun, talking to them, giving a high five, and baat karte karte I do my job and come back. So you just enjoy, no? You tell your brain, boss, this is what I have to do. Let me go happily. Let me come back happily. Rest will be automatic. Sir, what are the important components of a strong immune system that must be taken care from childhood? And can cough and cold be treated without antibiotics? Definitely. See, important components of a healthy immune system is, of course, immune system is comprised of your body immune system, mental immune system, your emotional immune system. So a lot of things are there. Nutrition plays a very, very significant role. First 3 years, first 1,000 days, I've already made a video on this. Importance of first 1,000 days, because first 1,000 days your brain is developing, your body is developing, a lot of things are children are learning, a lot of good, bad, ugly things they are going through, and it's a battle going on in their mind. So आपको कितना positively आप बच्चों से deal करेंगे, how good of a nutrition you're providing, how well you're talking, what's your language, what kind of atmosphere is there, a lot of things matter. So definitely you got to change your language, you got to change your approach, you got to change कि आप खा रहे हो, कि आप खिला रहे हो, कैसे माहौल में आप बच्चे को पाल रहे हो, right? Of course, antibiotics is not required for cold and cough. Every cold and cough does not require antibiotics. Please, even in fever, every fever does not require antibiotics. Virals, we don't unnecessarily give unless there is a chance of secondary bacterial infection या फिर suspected bacterial infection. My daughter is 5 years and 10 kgs, doesn't eat anything, only drinks milk 3 times daily. How to increase her hunger? Take a simple advice. ये 3 टाइम का जो मिल्क इंटेक है ना, उसको 1 टाइम करो. That too, never do it empty stomach. Never give milk empty stomach. The moment child wakes up, पहला चीज हम करते हैं कि दूध पिलाओ बच्चे को. स्कूल जा रहा है, दूध पिलाओ. उठ गया है, दूध पिलाओ. So don't do that. Shift the milk to evening or somewhere after breakfast or after lunch, but not more than 1 glass. Definitely you'll see a significant improvement in the hunger, right? I'm from Pakistan, and my 12-year-old daughter's hands and feet warm, especially after eating, warmth in the other body, in the body also. See, children might have warm hands and feet. If you're finding unusual warmth in the hands and feet, get the child examined, because there is a condition called as erythromelalgia. It's a rare condition, but there will be severe burning and redness of the palms and soles. I hope she does not have that. Well, nothing to scare, nothing to be worried about. Children can have warm body. Active children can have a little bit of a good metabolism. So don't worry about that. But get the child evaluated. Cradle cap, please talk about cradle cap. Cradle cap क्या होता है? कई बच्चों में you might have seen there is a dandruff kind of a thing on the scalp, right? There is dry scaly flakes on the scalp. This is called as cradle cap. It happens because of excessive oil secretion from the oil glands and from the hair follicles. ये बच्चों में अक्सर होता है. Newborn baby 3 months 4 months